My name is Frances Kilbertus, and I am a 2017 AMS Phoenix Fellow. I would like to share the story of my fellowship with you. I am a family physician and an educator. I spent most of my career working in urban settings, and about 5 years ago, I moved both my clinical practice and educational practice to rural Northern Ontario, and it has been a wonderful journey. My fellowship really revolves around three things. The first thing is palliative care. The second thing is rural practice, and the third thing is an expanded notion of what is learning. I am using in my Phoenix Fellowship work palliative care as a model of compassionate-based care. This is not the only model, but it's the one that I'm familiar with and the one that I'm using. The second sort of pillar in my fellowship is rural practice, and what does it mean to be a healthcare provider in a rural community? There's a lot of intertwining of the community and the healthcare providers in very interesting ways. So the communication between the community and the healthcare providers is sort of more intimate than, say, it would be in a bigger place. And this provides lots of opportunity to learn. So the third pillar is learning, and what is learning? So we are thinking about learning in this fellowship as something much broader than just acquiring the knowledge and skills to carry out tasks in your job. It's really learning that involves you as an individual, what you bring to the job, what are the skills and knowledge that you need to do to carry out your tasks, how you interact with your colleagues in the workplace, and how you interact with that community. How does this play out in my fellowship? Well, there's a few different projects in this fellowship, and one is about palliative care learning. So the question we are asking is, what are memorable learning experiences for you in palliative care? So we ask nurses, physicians, registered practical nurses, nurse practitioners, what is a memorable palliative care learning experience? We are doing scholarly work around literature search and a background document, and asking our question and justifying our methodology, and we're in the data collection phase, and we'll move towards data analysis and spreading the results in a scholarly and in our own local communities. We had to learn what's important for our Indigenous colleagues in asking questions of the people that work in their communities. So we are asking, we may have volunteers who are Indigenous healthcare providers, or we may have non-Indigenous healthcare providers who've had a really important learning experience caring for Indigenous people. So Indigenous experience and Indigenous knowledge may come through in our data collection, and we have to know how to respect and understand that. We're working with the elders in our community around this, and that has been a very wonderful and enriching experience. The second thread of this braid, if I could say that, is the community voice in compassionate rural palliative care, and the question of how do we hear that voice? How is that voice assembled, and where does it go? So we have a great resource and collaborator or collaborative team on Manitoulin Island called the Debajmajig Storytellers, and that is an Indigenous theatre company with whom we've done work over many years around medical education. And in this context, Debajmajig has started an initiative around death cafes, or bringing people together to talk about dying, which truly is talking about living, in a lighthearted and positive atmosphere that definitely includes good food. And we've had one of those events, and in fact in other areas on our island, these events have also started. As we look forward, we hope to develop some learning tools for the students that come through our communities, through the Northern Ontario School of Medicine and through other elective students. We hope to develop some tools that will have come from our Death Cafe experience on Manitoulin. So this understanding of learning really underpins our scholarly project on memorable palliative care learning for rural practitioners, and as well as our arts-based activities with community members. We consider all of this as learning, and therefore a really rich area to help us understand how learning happens for this compassionate-based practice. So what this project will achieve is a deeper understanding of how healthcare providers learn the compassionate practice of palliative care, and how this might be carried out in smaller communities. If we can understand that better, we can train learners in their formal education to be comfortable and competent and willing to undertake this compassion-based practice when they enter the workforce.